just for this piece of it. I'm Lori Carson, the Agency Director for Alameda County Social Services Agency. Welcome. I'll let Cheryl introduce herself in a second. We're kind of winging this. We just had a very brief conversation outside. Who's going to do what? So we've decided we're just going to wing it. We're going to have a good time. It's after lunch. We're still waiting for one of our panelists. So just to make sure everybody knows that they're in the place that they want to be in, this is the Faith-Based and Community Organizations panel. We're going to talk about what services are being provided in the community, maybe talk about what services are still needed out there that we're not addressing. Our panelists will be asked, I think we're going to go back and forth between 3, maybe 4 questions, depending on how much time we have. And then, of course, we want to have a dialogue. We want all of you to communicate with us as well about what you see out there, what you think organizations should be providing that they're not, and vice versa. I do have a couple of announcements that I was asked to make. This is left from the last group, but I thought it was pretty good. Cell phones off or on vibrate. Active listening, let's have a dialogue. And then step up, step back. I thought that was interesting. I have my own interpretation of what that meant. I'll let you all decide what you think it means, but I would say that, because this is actually a much smaller group than the one that was here earlier, if we can just make sure that, everyone that wants to speak gets an opportunity to speak, and we don't take up too much of the time at the mic, although there is no mic. So, a couple of the announcements. One of the purposes of today is really around making sure that folks can stay connected. So I was told that in your packets, you have the red folders. There's a list of classes that are being offered by the Carlton Community College, and many of them are related to the subject of today's workshops. What they've said is that there's a link on how you can get registered for those classes if you're interested. It costs about $150 per class, which is pretty inexpensive. The other thing they said is that the class isn't being offered. So if there's something you think you want to have a class about, it's not offered. If you email and there are enough people that are interested, they will create a class for you. Wow. That usually takes we need about 30 students. But given the number of folks that have been here today, I think we can we have more than enough to get some classes offered. The other thing that they said that they could offer a workshop. So if there's a topic that you would like to see discussed and you don't want to do the 17-week class, we could do maybe a couple of workshops on a particular subject. I believe also in your packet is, I thought this was really interesting, a social media site called Blacklink. It's the way that it was coined to me is it's like a Facebook for Black people. I was like, well, okay. I don't know exactly what that means, but all right, we got a Facebook for Black issues. Feel free to log on. And then if you are interested in creating, you have a business idea. There is a man by the name of Ali Rashid who has a consulting company, and he is willing to assist for free anyone who has an entrepreneurial idea that they would like to explore. I believe his contact information is also in your packet. So with that, I'm going to ask Cheryl to say a few words. Oh, evaluations. I'll let Cheryl say a few words, and then we'll go ahead and get started.
Shall we start with the evaluation?
Yes.
Let's start with the evaluation. Just go ahead.
Please, it's in your folder, and we're just going to ask that you fill this out. Not during, right after. And then I'll be sure to pick them up at the door.
Let's start by introducing myself. Cheryl Ward, pastor in this community. I actually retired from pastoring a church in 2009, student pastoral work, and my focus, which I was just sharing with honorable school board member here, is totally focused now. It has been for years. This is 35 years of ministry for me this year. And it's totally focused around youth and young adults, and really focused around stopping the violence in our community now. And so my focus now is dealing with, I'm tired of doing funerals for gunshot victims, and I'm really focusing around the kids who are left behind that aftermath and in terms of stopping the retaliation. So doing a lot of small group sessions with them, and a lot of the kids in my neighborhood, cooking for them, sitting them down at my own table.
So how about we start with Dr. Burns, if each of you don't mind, just a couple of sentences, 3 sentences or so, about what you do in your organization.
I'm the Executive Director of the Prescott Children's Center in West Brooklyn. We provide family support services. We've been doing that for about 7 years. Health and wellness. We have a mobile asthma clinic called the Red Pill Immunization Clinic. Senior wellness program. We're heavy into art and culture, visual arts and theater arts. We have a food pantry. Since we started the food pantry about 5 years ago, it's quadrupled in size. It's a great need for food in our area, and obviously in other areas, low-income people. We have after-school programs for kids across the street at 2 schools and in other areas in Brooklyn. We have a 6-week summer activities program in West Oakland that gives activities for children in the lower bottom. There weren't any programs there in the lower bottom of West Oakland. We started the program. And usually on Saturday afternoons, I'm more comfortable patrolling the sidelines of the soccer field, but I'm here today.
Good afternoon, everyone. I am Gloria Crowell. This says Gloria Crowell Cox, but it's really Gloria Cox Crowell. But you just call me Gloria. I serve at Allen.
There's been a request that people stand up because there's folks in the back that can't
Oh,
quite hear
stand up.
or see.
Oh, you can't see or hear. Okay. So, good afternoon, everyone. I am Gloria Crowell, and I serve at Allen Temple as the Director of Development, but also I do a lot of work in program planning and development for all of the many activities that occur at Allen Temple. Notably, I serve as the primary coordinator for the new Robert C. Scott Wellness Center, which will be primary care clinic on the campus of Allen Temple. We too do food programs. I agree with Dr. Burns. Food is a major concern in our community. We do HIV/AIDS programs, we do health and wellness programs, and we're really moving fast into fitness and recreation programs. So welcome to you all.
Good afternoon. I'm Pastor Raymond Langford, CEO, co-founder of Healthy Communities, doing business as Healthy Oakland, and we provide what's called integrative health services. We have the first African-American faith-based nonprofit to be a state-licensed community clinic in California's history. We have about 50 employees, half are formerly incarcerated. We provide mental health, alcohol and drug services. We do the violence prevention street outreach for the city of Oakland, for West Oakland. A program that we've been doing in partnership with social services for the past 6 years. We have launched an effort to recruit foster and adopted families, and we have seen their roles reduced by over 50%. But we do recruitment throughout every church, regardless of their denominational background. We do recruitment at the local churches. We also do recruitment at county fairs, parks, etc. You name it. So this is a recruitment event for me. So I want you to repeat after me. Say recruitment. Recruitment. It's everybody's business. It's everybody's business. So if you're interested in becoming a foster adopted parent, you need to see me afterwards so I can sign you up. Thank you.
Very good, Reverend Langford.
Good afternoon. My name is Sonia Waters, and I work with the Family Resource Network here in Alameda County. We opened our doors back in 1992, serving parents with kids with special needs, helping to educate them and navigate them through the services of special needs as far as health, education, hospital stays, and services that come out of that. I've actually been working with them for over 18 years. I am a parent of now a 27-year-old with developmental disabilities, and I'm thankful to be here today because there isn't anyone here on tap that's talking about how all the disability issues for children, their services are not being met, and then the outcomes we're now looking at, children hanging out on the streets because no one paid attention that they needed some support and help. We have young mothers who are now having children with special needs, which was unheard of in years to past. It was like anything after 40, then a parent might would consider it. I work with clients as young as 17, 18 with children with developmental disabilities, a lot of speech and language issues that are not being met. And so I'm glad to be here just to put the word out there. We need support. We need to be able to support these parents along with their children with disability. I'm also seeing there's a lot of issues around mental health for those parents. So the mental health and their child services are kind of hand in hand. I'm also working with First Five. They passed out some information on it, doing Help Me Grow, which is a way to go in and look at children before they turn 5. We've got a lot of our kids, especially African American kids whose parents are, I don't know the right word to say, but for lacking of knowing, they're afraid to admit that there may be something going on with their children, and they don't start getting help for them until they start flunking out of school in the 3rd, 4th, and 5th grade. We are there to try to support them early on. The earlier we put in early intervention for children, the better it is. In Alameda County, 90% of the families that we work with on a day-to-day basis, at least 40% of those families are Black. Wow. 40% of those families don't know that they can go and ask for support. 40% of those families don't know it is an entitlement for them to receive services through our school district for our children in special ed. So thank you for having me here. I hope to see more of us next year participating in something like this because we do go hand in hand with the mental health and the development of our children. Thank you.
Okay, so we're getting ourselves situated and organized over here. You want to ask the first question? All right, so the first question for our panelists, and I'm gonna, I may ask different panelists to speak to different questions, so just for the sake of time. But for Gloria and for Dr. Burns, what are the most recent trends that you're seeing in providing services?
I think the most important service right now, changed in recent years, is culturally developed mental health services. People of color do not access mental health services very well. And the fact that they now are being offered for, specifically directed culture has been a major contribution. And of course, we've been working for 7 years in another road to safety program, which Lori is very familiar with, which brings the family advocate into the home of the recipient families. And this has been a major change. It's not new, and I hope that more and more social service agencies are adapting this program because we found significant success in what we do. I mean, for instance, the ARS program was developed. We get referrals from Child Protective Services to see children that may be in danger, and two things that the program does is objectives are to keep the families out of the social service system and to decrease displacement foster care. And the average displacement of kids to foster care in West Oakland is around 280, 290 kids per year. In 7 years that we've been working in this program, we've only displaced 3 kids to foster. So this is a significant program that is very helpful. The families get into it if you guide the families.
That's great.
recent trends in providing services. So I'm at Allen Temple. How many people in the room are familiar with Allen Temple? Okay, so for all of you guys who are not familiar with Allen Temple, I tend to joke around and say that Allen Temple is really a social services agency that happens to have church on Sundays. Because the bulk of our work that we do is really Monday through Friday, and we're a 7-day-a-week church. We do a lot of work on the campus every week, and I would say that mental health, healthy eating, exercise, and spiritual health are really some of the focuses, I don't know if I call them trends, but I would say focuses of where our faith-based and our community-based organizations kind of need to be really moving forward. Reverend Eunice Shaw at Allen Temple always says, we're not going to be able to have healthy communities until we have healthy fathers. And my colleagues in the room really know this. So we really need to look at how our community is going to be healthy from the inside out. So we need to look at it from the inside out. I believe in collaboration. I believe that we can't really be successful going at things solo. I believe in working with Alameda County Social Services. I believe in working with Alameda County Public Health. We're paying our tax dollars to these organizations. So we want to really partner with these organizations to ensure that our community is going to be healthy. We want to continue to look at the youth in our community, and we want to also let them know how best to be healthy from the inside out. So if I had to say any trends, I would say those kind of 4 things: the mental health, the physical health, spiritual health, and then also exercise and healthy eating. Those are kind of the things that we're focused on at Allen Temple.
Thank you.
So she has your questions, you're good.
Well, Regina, you can actually stand up. We're going to ask you to just do a quick introduction of yourself.
Take another deep breath.
I want to apologize. We got a last-minute invitation to do our presentation for community development block grants, and because I'm in the middle of a $7 million renovation, and we have a request for $300,000 out of CDBG, I kind of needed to take care of that. I hope you all might forgive me for that. Am I forgiven? Outstanding. Okay, so thank you very much. I am very pleased to be here. All these esteemed folks. Okay. The East Oakland Youth Development Center has been providing extraordinary services to the Oakland community for the past 35 years. If I had to talk about the focuses that we have, it's that our theory of change is steeped in character development. So in retrospect, we are building character to build communities. We do that through a variety of programming focused on education. Whether we're doing our wellness programming and track and field, basketball and martial arts, or performing visual and culinary arts, or GED and workforce development, or Pathway to College and After School Leadership Academy, it's all the halo approach to education, trying to help our young people to learn more, believe and dream more, be prepared by building their capacity so that when success comes, and it will, whether that's in the form of a job, a GED, acceptance to college, what have you, that they are in fact prepared to step into their own greatness. Now we have several youth-led initiatives because we really believe, you know, myself, I've been in the capacity almost 20 years. At the time that I took over, I was like someone's parent. Now I'm like somebody's great-grandparent. So we believe that by building our young people's leadership capacity, that they in fact teach their near peers and can give them a spectrum of what the world looks like 4 years, 6 years, and 8 years down the road. So our young people in Pathway to College are on 50 campuses across the country. They're not just getting BAs or getting masters, they're doing PhD work. They are committed to returning to their communities to do work in social welfare, health, you name it. Through our service component, which is really threaded through all of our leadership strategies. they understand that they have a responsibility, not just to the young people that they pass in the hallways when they're doing their different programming, but that they have a much bigger responsibility to the communities where they choose to reside. They don't all come back to Oakland. So we want them to be better, more responsible citizens in Oakland and wherever life takes them. We have exceptional partners in several of the people up here, whether we're doing, our Clean Up Our Crib, which is community cleanups. We want our young people to start out there understanding that leadership is not always cute, but is always, always necessary. Our programs are free, and I don't know if I have gone past my time. Okay.
Thank you. So this is a question for everyone. Why don't you do that?
So, we want to give you a minute to catch your breath, Regina, but this one, I think,
Come on.
is good for perhaps you and Sonia. And let me tell you, with glasses, I have difficulty seeing double partners. So I'm going to lean over a little bit on Lori to help me see a little bit better. What models of outreach to African American youth and adults are working the best? And which ones can be replicated and expanded? So which ones are working, which ones can be replicated and expanded?
Okay, so the ones that are working, and they will always work, is word of mouth. If someone likes what you do, they're going to tell somebody. The things that can be replicated and expanded, and we've just stepped into this space, is the social media. You got to go where your clients are. So it's Instagram, it's Twitter, it's Facebook, responsibly trained so that the messaging is all good. We're not trying to get our hustle on. We're trying to teach our young people to be very creative and very resourceful. Certainly media never hurts, but media's not always around when you're doing good things. They're always around when you're not doing good things. So I'd say word of mouth, excellent reputation, responsiveness to your community. If they see you doing positive things, they're going to figure that they need to come in and see what else is going on. And partnerships. We have them with educational institutions, we have them with community organizations, we have them with volunteerism efforts, we have them with corporations. We work in every kind of way we can to get resources in for the multitudes.
Okay, some trends that we've seen. As I said, I've been with the Family Resource Network for about 18 years. And when I first came into Family Resource Network, as an African American, I first noticed that was the first thing. I didn't see any of my clients that looked like me coming in. I knew there was a whole community of black folks with kids with special needs. So through the work that I did, I started going almost like the old-fashioned way, door to door. I went to doctors, we went to hospitals, we went to school sites, and once they were able to see someone like me, they were able then to come to the doors. And I think if anything has changed, which I'm glad to see, then now we're actually reaching out. We're now asking the question, man, my child is 3, and he doesn't speak, but I have a 2-year-old that speaks off the hook. In the past, parents didn't really go, well, he'll catch up. He'll catch up because Susie caught up by the time she got 7. Well, they didn't realize that by the time Susie got 7 and hit school, by the time she got in the 3rd and 4th grade, she was then categorized as, she's slow, or she's not getting it. And then parents were brought in like, you're not doing enough. And we took a lot of that in as personal. As black parents, like we're not doing it. We're not seeing our kids like we see the other kids in the classroom doing well. Well, what was happening was that a lot of our kids had concerns. A lot of them had issues that were going untreated. And a lot of it was in our community because as you all know, we have stigmas just like other communities have. If you know that I may have a mental health issue, I don't want to tell nobody that because then people are going to judge me. It's even worse for a family that has a child with a special need. And I can use myself as an example. In my family, I was the only person that had one. I didn't know any black people out there that had kids with special needs. And through educating myself and just going out hunting down information, there's a whole community. I call it the community of disability. I was born into a black culture, but I also am the culture of disability. I can share this with any other person with a child with a special need, be it black, white, Asian, whether you got a lot of money, no money, however it be, but we are working in it together. And so now I think what's happening is that we have been really moving forward to try to push the system, education system. We were going in asking for support services in school, and they pat us on the head and says, well, let's wait, let's study them, let's study your child. But another family, a white family or someone else can go in and say, you know, I've got concern. They immediately give them IEP assessments. They immediately put them on the track for services within the school district. So for those that may be just a little having a problem, they're able to work through their problems. By the time they hit middle school, then they're flying on. Then we have those that don't fly on. And in my day and time, they used to pass you along. What did that do? We see a product out on the streets today. A lot of black men, they're out there.
Let me pause you a second. So let me ask you a question. So in your role, what do you think is, since you have more parents coming forward, what do you think is causing those parents to come forward for your services now?
I think advocacy in our community, not being afraid to come up and ask now, whereas before you didn't hear about disability in our community that much.
Okay.
We do a lot of workshops in Alameda County.
Okay.
We partner with First Five. One of the pamphlets I helped is called Help Me Grow. This was funded from the federal government to come into Alameda County and look for those kids that are just right here on the edge. They don't have enough to qualify for special education services or services from direct services, but there's still enough for us to pay attention to. Now we're able to go into these homes, meet these families, talk to these families, and because they see us as a partner, they're able to then express to us, you know, there are some concerns, and there are more concerns that I even told the intake person.
Okay.
Okay, that's been helping. We also have been working with First Five to do what we call navigation. And it's funding that comes in, again, looking at children 0 to 5, because our thing is if we can catch them before they turn 5, we have a better chance of helping them. Parents are now buying into it.
So how do you directly outreach to parents with children from 0 to 5?
We do a lot of workshops and trainings. We've been going out to doctors' offices. We have been really advocating with the doctors in our community, Children's Hospital, Highland,
So
places like that.
Are you going to doctors' offices
Yes.
and leaving brochures?
Yes, constantly,
Are you-
yes.
But how are you getting to the parents?
Well, we have 4 of our resource counselors that go to the hospital. We made partnerships with a lot of the nursing staff for intensive care. So when a parent comes in and their child is born with a special need, we'll get a call.
Okay.
We go up to the hospital, we make ourselves available. We don't push ourselves on them, but we do make ourselves available if they want to talk.
Okay.
We also go to the school district. I've had a lot of partnerships with Oakland Unified School District. I'm also an active member of the CAC committee.
So
for the
how does
school
it work
district.
with the school district?
With the school district is maybe about 10 years ago or so, we did a partnership with them. The school districts were doing training for parents just on everyday things. We started bringing in trainings about the IEP, when to know that there's an issue with your child. Parents started coming out. Hoover was another school. We did Parenting University. That was another way to get parents out to understand, even though they were coming to Parenting University what they thought for typical kids, but because we did workshops in those areas and they listened, then they began to realize, oh man, that might be related to my child.
Okay.
So we do a host of things within the community as much as we can. We are at every event that they have out there, handing out brochures. We've been working a lot and partnered with the early Head Start programs. We also do trainings for their parents, which is transitioning from 3 to 5, making sure parents are ready, and if they have some concerns, we try to go in there, talk to the parents, get those kids assessed to make sure that when they get ready to hit kindergarten, they are prepared with the necessary things that they need. Some kids will swim through, some kids may not.
So we're gonna, this is so awful for us. I just want to
Oh,
tell
no,
you.
you're good.
But we're gonna have to cut some of you off
That's fine.
so that everybody can get, you've got great information, and so I hope you guys are taking notes and formulating your questions, but we're gonna go ahead and let Regina, thank you, let Regina make a brief comment, and then I have a follow-up for all of you.
Okay. Although the 0 to 5 audience is not a primary program participant for EOYDC, we recognize how important it is to make sure that those young people are ready for school. So we developed a partnership between Children's Hospital and Lotus Bloom to have an early childhood playgroup so that parents could learn how to engage with their children and so that we could teach them some games to see if there were some learning disabilities. One of the things is the parents sometimes think, young parents think, you know, put my child in front of Sesame Street and it's all good. That's all bad. So we wanted to be able to break down those barriers. In terms of the partnership, Children's would refer, Lotus Bloom would refer. It was special because we're in East Oakland where the area is 3 times the child abuse reportings, 3 times the stress for women. They need the support.
Thank you.
Great.
Thank you. So the follow-up I have, and I actually want to open this up for any of the panelists to speak to, and it's really around barriers. One of the things that we're hearing is that there are services that are available in the community at your organizations, and you have all of these various mechanisms to engage families, to engage youth, adults, fathers, mothers, etc. But what are some of the barriers that you've identified that maybe we can start to think through some strategies beyond just what you put here, but the stigmas that are out there, relationships, what do you see as the barriers? And I'm gonna open it up to whoever wants to speak first. Dr. Burns.
Thank you, Lori.
Oh, wait, Dr. Burns and then Reverend Langford.
I'm going to cast a negative on what the 2 previous speakers have said. We offer a mobile asthma clinic service, a Cadillac clinic that goes out to schools, see kids identified with asthma, give them better service than any hospital, Kaiser or Children's, on an appointment system. If you're there, if you have a 9 o'clock appointment and you get there at 9 o'clock, you're out in a half hour. You can't beat that anywhere. Thorough evaluation, more than Children's Hospital does, actually. They don't do skin testing. We do skin testing for allergens. We do it all for free. If a family doesn't have access to insurance, we give them medication until we get them on a plan that they can get their free education. Our response from the African American community has not been what it should be. They do not take advantage of this service. We do everything we can do to try to get them there. The same is true with our immunization clinic. I've lobbied for the Public Health Department to keep that clinic there in West Oakland because the immunization rates for African Americans and Latinos are the lowest of any group. African Americans are the lowest participants of this service. And I don't know what it is. And I don't know how to get them. Okay, but I just want to tell you that. I personally think, and I don't know if I'm jumping ahead of the program now, but one of the major problems is education. My social service workers tell me that literacy is a high barrier for use of services. Okay, we've got to do something about this, and and of course, education is paramount. Now, I'll stop there, but I don't want to get started.
Thank you, Dr. Burns. I think I know one of the barriers is that because of the diversity of Alameda County and Oakland, we often have these silos in government and education that look differently at communities of color. In Alameda County, foster care, not foster recruitment, but foster care removal rates, 54% out of East Oakland. Wow. 18% out of West Oakland, 18% out of South Hayward. So you can see that the county's business is focused in 3 areas where you have a high percentage of people of color, especially African American youth. what we have to do is, and then the communities, we speak one language, they speak a different language. I'm a pastor. A lot of people don't know that I'm a social worker. And I been licensed in this county, I was for many years. My wife and I were foster parents in this county for over 20 years, and we care for many children. So I bring a different perspective to the table, and I think that has helped our agency in the work that we do. But if you really look at the work that's happening within the community, Alan Temple has been doing this work, EOYDC has been doing this work, Dr. Burns has been doing this work. My sister here just recruited us to do her work with her. So the work, so we're known for doing the work. We're going to do the work anyway, right? But what we have to do now is we have to, in order to address and remove the barriers, we have to partner. And I think that's where some of our agencies have healthy relationships with social services, in particular, the Alameda County Faith Initiative. That was a partnership that was birthed through the administration, and Lori was the scribe at that time that wrote the...
A little louder, Reverend.
Yes, but Lori was, and her leadership then, she worked with us there. She also worked with the Title 4E, and the faith community worked with the department. Other existing agencies have benefited from those resources. But now what we need to do is make sure that other agencies such as EOYDC, Dr. Burns' organizations, the great work that Alan Temple is doing, that we now can speak the language of government. That we're not seen as a pawn, but we're a real partner. What I mean by real partner, when you have a real partnership, there's planning resources, there's training on the inside for staff, but there's also training with our pastors and our community leaders. Case in point, we were challenged when we became the head to oversee the Alameda County Faith Initiative. How are we going to work with families that want to foster or adopt kids and they come from a gay or lesbian background? Are we going to treat them any differently? Are we going to be fair to them? Are we going to be loving toward them? How are we going to approach them? And you know, for many of the pastors that work with me, that was a challenge put out there, but guess what? I told them we've been doing it anyway. We got brothers and sisters in our church, lifestyles anyway, so, but it was really not really knowing. So we do have the barriers, but I think too, how do we as Alameda County, how do we look at best practices? Yes, we can go to New York and we can go to Texas and we can go to Chicago, but what's happening that's going well in Alameda County? Well, I can tell you when Alameda County Faith Initiative was birthed, now LA County has a faith initiative. Now Pomona County has a faith initiative. We just got off the phone with San Bernardino County. They're getting ready to start a faith initiative. Santa Clara County has started a faith initiative. So what's happening now, people see the importance of working with the faith community. And not just the faith community, but how do we really partner with an agency such as EOYDC, that 70% of her children are in relative placement homes or come from a foster adopted background. How do we give support to such a great program that's dealing with education? Our kids are going to college and they're coming back. So we begin to shine the spotlight on what we are doing in Alameda County, what we're doing in Oaklanders, and if we focus on East Oakland, I guarantee you we can make a difference, we can make a change.
Okay, time check. Gloria, did you want to say something?
Yeah, and I think I agree with him wholeheartedly, and I think part of the problem is that we have all of this great information in Alameda County, but we as people, and that's why I charge our community. We up here can only do so much. What we're looking for is for the community to step up, for them to finally start, when you see a mom in peril, and you know there's something going on, put your hand on that parent. There's something going on. How can we help? We spend so much time throwing our nose up, or we see that we look a little different, maybe how we dress, how we walk, and then we make assumptions, for lack of a better word, of the people out here doing the work. We are working very hard. I know I go out to the schools. We talk to parents. We handhold these parents through filling out paperwork for Social Security. We hold their hands to help them get connected with Medi-Cal. You'd be amazed how many families are still not connected to healthy families. There's so many kids here that could be on medical plans, but no one has ever told their parent they can do it. Or an agency, well, I went over there and they told me they can't help me fill out the paperwork. Why don't we sit down and help them fill out the paperwork?
And on that,
Thank you. So go ahead. Go ahead.
So I actually wanted to piggyback on what this sister is saying, because I have a challenge for all of you out there, and that really is this. You're hearing some good information about what is going on at these individual organizations, but what about you getting some information yourself so you can share with your neighbor, your cousins, your nieces, your nephews, so that when your own family or community or your neighbor or somebody is in a little bit of peril, you have a resource where you can tell them where to go. I mean, you should be able to look at a resource sheet and see what's happening in East Oakland or West Oakland or North Oakland or South County or East County, because people are hurting and they're in peril. At least if you see some folks that are hungry, do you know where to tell them to go get a hot meal or a bag of food? Because that's happening all over the place, but do you know where to tell somebody? So we need all of us to be able to share, because we're not doing this alone. Pastors can't do this alone. Pastors are looked up to, but they are not the ones who are going to have every bit of every information for the whole community to share. So I need to be able to know what's going on at EOYDC, so when youth come to Allen Temple, we can't do everything. I need to send them on over to her. When she has folks who need to get a health clinic or an HIV test, she need to come on and send them over to us. She had 30 people get HIV tested the other day between 10 and 12 at her agency. So I need to be able to know when that's going on, so I can send people. You can walk 2 blocks down the street, take 1 minute, get an HIV test, know your status. So there's just some things that we need to know for ourselves so we can help each other.
So you get your test results back quick now, huh?
1 minute. There is
1
the
minute?
1 minute
Rapid
test.
test.
There still is the 20-minute swab, but there's also a 1 minute test. You can buy that at Walgreens. You can go down there today and pick it up.
So,
Regina, go ahead and make
We'll
the
come to the
final
audience in
comment.
just a second.
so I wanted to say 3 things. Neglect and hopelessness is a disease. For those of you who know people that are, not doing anything with their kids, you need to hold them accountable. You need to either help them educate themselves or challenge them. I got some great parents, but I got some trifling parents too. But I try to treat them the same way. Make sure they know what a healthy meal looks like. Make sure that they know where to go get it. So there's no excuses. The second thing is, for young people coming into my building, I don't care if they're 5 or 50. Young is relative, right? There's structure and discipline that's required. Nobody's rolling in, cursing, sagging down to their knees, doing whatever they want to do. We have structure, we have discipline. From the moment they hit the door, we communicate that we expect excellence. But we have some rules that you're going to have to learn to follow, because everybody can't show up like that. They have to learn a different way to communicate. And then in terms of program services, like what Gloria said, we don't do it all, but if you can responsibly know where to refer, we refer people all the time. It's not our expertise, but if we're not the experts, we know where the experts are. So we don't say no to anybody.
And if you don't know, 211 for Alameda County will be able to give you just
Go
about
ahead.
anything you need.
That's a good resource.
211, write it
Good
down.
resource.
So we have about, I'm just going to say this. I think we knew it was going to be a challenge because you guys all have a lot going on and have responded very well to the questions that we've asked. But now we want to open it up to the audience. You will be subjected to the same but we want to open it up to the audience so that you can ask questions and make comments. So I see my sister over here. If you want to go ahead and stand up, and then I see you as well.
I appreciate you all and the information you've shared. It's a wonderful thing. I know young people and I know seniors and silver people. So my question is about the older people. What if the child is now a young adult, 25? Are there services and stuff for that age group?
Absolutely, there is. There's lots of things going on. Center for Independent Living provides a lot of help and support for young adults. In the community, we can make referrals to other smaller organizations, depend on what that parent, or especially if we do. We have a lot of older families now raising their older children. They have placements where some of these families, my son is in a group home and out of the area, but they have group homes here for adults to be in that are ran very nicely, that they can have a full life So there's a lot of things going on. I gave you information, call me up. Pass it
For
on to you.
myself, 25-year-olds can do workforce development year-round, job training and placement. If they haven't got an education, GED. If they want to return to college, pathway to college. Our wellness area, they can do adult fitness, so there's any number of things that they can do.
And we're in the Bay Area, really Berkeley Center for Independent Living really led the model across the country about really providing services for people who are disabled or who have disabilities.
And just know too, my son, who now works for the Mandela Project, he was, we were informed that he would never be able to live by himself. But he's a 25-year-old male that's been living on his own since he was 18. He has a high school, he was special ed all his life. But he has a high school diploma, he has his own apartment, he has a bank account, he's got an excellent FICO score.
And that to his point, and let you know, don't discard our families with children with special needs, because our kids, like with my son, they told me at birth, oh, he wouldn't be able to read, he wouldn't be able to write, he wouldn't be able to da-da-da-da-da. He plays piano like nobody's business.
And
He's
he
in a
doesn't,
group.
he doesn't have any children.
So
yet either.
panelists,
No.
panelists.
This is for the audience.
I have a gentleman over here, and then I see your hand in the back as well.
Yes, my name is Fulton Tyrone Hopkins. I'm a veteran, 100% disabled veteran. Is there any veterans in the house here? Are there any family members of veterans in the house here? Okay, well, the VA should be here, for one thing. This military complex affects all of us. And I would like to say a few things. American Legion brings in almost $100 million a year on dues alone. The people who are affected, affiliated with the VA, family members are servicemen, should be a part of American Legion. And for a long time, it was a racist white organization, but those people have died out, and they're looking for new leaders in these positions. That's why I'm a part of this. It's called the Big Gap. That's why we're all here. How can we connect? The VA has so much support and money that Obama, God bless his soul, is in the pipeline. You don't know how to utilize, get to the money, I do. As 100%, I know how to navigate through the red tape. And as 100%, they don't say no to me, they say, how can I help? So I'm here to keep their feet on the fire, to make sure that their services are connected with your services. And these veterans do not know their benefits and how they are, what they're entitled to. I am here to help them with their claims. And when they come to me, they can't deny me, because I say, I got mine. I can help you get yours if you have some structure, if you're really serious. I'm here to break the cycle of violence. And most of the violence that you have is frustrated veterans beating up on their wife and their kids.
Speak on it.
So I never hit my son, and there's a reason, because I can talk to him now. My father was a great man, God bless his soul. My brother's a colonel, retired colonel. My other brothers are ordained minister at St. John. It was a reason I'm here, and I came back here. I did this whole program in Detroit and Indianapolis. It's a template now. They're looking for this program and how to move it. One more thing before I sit down. NAMI has a program, which is National Lincoln's Mental Health Initiatives, directly to the black churches. It's a conversation about mental health issues, the stigma of mental health, that has never been addressed in the black community. Never.
Say the name again.
NAMI.
National.
Alliance of Mental Health Initiatives, I believe it is. But they're already in the community. These organizations are right here. We're missing each other. I'm the conduit here now. I'm the one who can get in the VA's face and know all their games.
I'm trying to see you.
And what we need to do is to make sure, we got to make sure that they are committed to their obligation. Because when you raise your hand, if it's over 90 days, you are entitled for certain benefits. And if we don't make sure that the community knows what those benefits are, and every year, there are more and better benefits. The VA that I went to is much better than the ones, I mean,
My daddy went to.
exactly. And I'm working with veterans from World War II who never got their benefits. I'm walking in there, they like kindergartners.
Okay.
You know, just overwhelmed by the magnitude of the VA.
Yeah.
Thank God that I, through my life experience, have went through that hell and come through half normal. But you know, I'm still working on myself too. But we are all broken here,
Right.
and we got to come together and think about the future and our children. Thank you.
Thank you.
Hello. Hi. In looking at what's being broached here, the foundation of what is being discussed is on what is presumed to be a foundation in place. My question is if this is not the arena, maybe everybody can go home and give it some thought and come back together. Is there any room here to give thought to emergency survival level, not organizational wise, but us as a community? For instance, the United States government is setting the sequestering thing over us. They're talking about coming in and making a whole new branch of cuts. Some of these organizations that you're speaking of may not even exist in 6 months or to a year from now. We as a community do not have an emergency plan. I don't know of any church that has an emergency plan. We as a people have to begin to look again, which is being approached educationally and everything, but if we don't survive, that goes for naught. We need to know where we could get water, where we could get food, where we could get generators. Should it become necessary, and it seems like the way things are going, it's going to be necessary. So I'm here to ask, you know, thank God for all of this that is in place. Thank God for all this functioning, but there's a level that is not being looked at. If the lights go out in the next 5 minutes, what are we as a people going to do?
So, before we go to the panelists, I'm actually going to go to the back of the room because I believe we have a response to that. And then if you, panelists, if you want to add something, I'm also going to point out that we really are at time, but...
And you have to do an evaluation.
Good job, that's the only thing I'm doing.
Thank you, Lori. My name is Anna Marie Jones, and I'm the executive director of an agency called CARD, which is Collaborating Agencies Responding to Disasters. So we work directly with the county. Our entire mission is really to reframe this entire conversation about preparedness and disasters around nonprofits and faith agencies, because nonprofits and faith agencies are the family units of civil society. In the same way that you wouldn't go knocking on somebody's door and try to separate people that way, we should be looking at nonprofits and faith agencies and understanding they have a unit, they have a way that they can reach, they have a way that they can protect and help other people to actually take on that level of preparedness, response, recovery, and all of that. And I would tell you that it has nothing to do with earthquakes, floods, fires, terrorism, and all the other stuff you hear about. Readiness and preparedness is about addressing the issues we're talking about here. This entire conference is about our daily lives. And the more we make the conversation about the earthquake, the flood, the fire, the act of terrorism, the less relevant it becomes to us. I would urge you all to look at it as an everyday experience. If I had known I could have done this, I would have brought enough whistles for all of you. I mean, it's the littlest things. It is, don't ever leave your house without something that leaves you feeling safe. For me, I always have whistles, flashlights, that whole thing. How many of you have a cell phone in here? Raise your hand if you have a cell phone. Honestly, look at what you could put in that cell phone that will leave you more prepared because you've got this freaking awesome tool in your hands. Every one of you has a cell phone. That cell phone is more powerful than the first 5 computers I owned. So you should honestly have all of those non-emergency numbers. You should have all of your medical information. All of those things leave you walking this world safer every minute, and then we can have a better conversation about what do we actually do?
Could you
So-
tell everybody the name of your organization again?
It's called CARD, Collaborating Agencies Responding to Disasters, and I'm Anna Marie, and I've worked with actually several of the people up there, and we actually have lots of fabulous success stories because what we look at is making it simple. Make it so that it's every day. Make it so that it's not about things you can't control.
How would people contact you?
You can always call my office. My office is at 510-451-3140. You can also always write me. I'm at AMJ, those are my initials, AMJ@cardcanhelp.org. Cardcanhelp.org. And we work with agencies, and whatever your level of resource or lack of resource, we can help you take those steps to be safer, more able to address those sort of safety needs in your community.
So what we will do, I will ask that the organizers who were I see them outside, so I'm going to grab them. We'll get your information. We'll put it on Blacklink, which is the social media internet site that I mentioned in the beginning, so that you actually have the information. You can go there and get it. I'm being reminded that you need to fill out your evaluations, and I believe that our panelists want to, at least one want to say something in regards to the disaster question. And I really was, but you know what? I will continue. Go ahead and ask your question.
What is the county doing about the murdering problem?
What is who doing? What is the
County
county
doing about the murdering problem?
Well, I think of it as a collaborative, and so I'm going to ask our panel members to talk about maybe some of the efforts that are going. I mean, there are efforts throughout all of the organizations. I mean, if you were at the panel earlier, they talked a lot about public protection and public safety, what was going on there. But do any of you want to address?
Yeah. Hey, Pastor Simmons, what the county is doing, the county is actually partnering with local cities, especially Oakland, to address the murders.
Let me hear you, man.
I said what the county is doing, they're partnering with the city of Oakland and all cities in the county, but especially Oakland to address the murders. They're doing it one through behavioral health services where they have the crisis intervention, crisis response team. Whenever someone is shot or killed, they have a staff that responds immediately, provides mental health intervention immediately and ongoing support to that family. They're also supporting through making sure more police sheriffs are driving through the neighborhoods to pull people over that they think are suspect, to get guns off the street. They're also partnering through Santa Rita County Jail, ensuring that there are better services for the young men and women coming back to our city, as well as the same is happening through juvenile hall. So the county is doing a lot. They're also partnering with local faith, community-based organizations to apply for joint funding to bring necessary resources to the table to address this epidemic that we're having. Well, here's what I want to say. Lori Cox is the Director of Social Services Agency. She served previously as the Director over the Child Protective Services.
She holds it down.
She's a young lady. This is important because we can ask 50,000 questions, but this sister has the largest department in the county. She manages the biggest budget. And she's very concerned about all communities, black, white, Latin, Asian, whatever, homeless. But the key is, what we can do is, if we can come up with a plan to work with her, to work with the general community, then we can address the violence, we can address the crime, we can address the foster care, adoption, homelessness, education, etc., etc. But if we don't work with her to work with us, then what happens is she's stifled. She's one person that's responsible for probably 4,000 or 5,000 people that's employed through her department. So I would encourage us to, and it's interesting that she's the only department head that's participating in this process today. She's worked with every one of us for years. So the key is that right here. Raise your hand, Lord. That's the lady I'm talking about.
May I ask a question?
Yes.
What are we doing about crime prevention?
Hold on. What we're doing, there's a lot that we're doing about crime prevention. I can talk with you offline after that. But here's what I want, what she wants. She needs our support. How many of us know as parents you need the support of your child to cooperate and act right? Amen. So we can't just expect that the department heads are going to do it We have to do our part. We got to get active. We got to get involved. We got to become supportive. I just buried a little cousin of mine who got shot 21 times. And you know what? I had to begin. I'm now asking. This is the sixth family member that's gotten killed of mine in Oakland. So you know what I'm saying now? I'm asking mothers, when your sons come to you, what are you talking to them about them guns you know they got? Them drugs that they're having. In other words, we got to be more responsible, more responsive with our own family needs and issues before we push it to someone else. Secondly is, there are a lot of community-based, faith-based, and other organizations that are doing some work. Some work is better than no work. But what we need to is get involved. We need you can get involved with Prescott Joseph, EOYDC, Allen Temple, Family Resource Network. You can get involved there, but if you don't get involved anywhere, then the key is that people are going to continue to do what they're doing. But let's get involved, let's get active, and let's organize so that, you know what, this time next year, we can come back and talk about some good outcomes that's happened in our community, all right?
So the last word is, we come to these things all the time, and we say, you know, that show was good. I went to this thing on Saturday, you know, we talked about some good stuff, and, you know, that show was good. Remember that thing we did last month? But what do we do when we leave here today going forward? So, I offer to have a roundtable follow-up that we could schedule and have at Allen Temple. I offer, open up the doors wide, and we can come up with some strategies and solutions to work with social services or public health and behavioral health on some of these things that we have questions on. So the offer's on the table, organizers, y'all can work it out and
Thank you. So, people are asking for contact information of the panelists. Folks have business cards that we have up here. Feel free to come up and talk with the panelists, and please turn in your evaluations.
And please get involved. Don't let today not get you involved.
Let's give our moderators a clap.